Yo, what up? It's a tip of the week, and today we're going to discuss how I know if I look at you, you'll be successful in surgery. Alright guys, are you a doctor who's trying to figure out, man, I really want to get into surgical dentistry. You know, I want to take out wisdom teeth. I want to do simple surgeries, simple biopsies. I want to be able to place implants. I'm also thinking about doing some IV sedation just so that I can kind of boost up the profits in my practice. If that's you, I'm going to give you the tips that's going to help you know how successful you'll be. Alright guys, I'm Dr. Jared Williams, and I wanted to share with you this information because I've been practicing for the last decade. I've done 10,000 surgical procedures. I've worked with at least 30 some odd doctors here in the Houston area alone. And one thing I found is that smiling after surgery is a principle-based science. And what I want to do is provide for you these tips that you'll be able to smile after surgery. So if you're a doctor who's having issues trying to figure things out, such as, am I going to have success practicing in the surgical arena within dentistry? Well, then this week's tip is just for you. Alright, so the number one thing that you're going to need to know to understand, hey, will I be successful as a dentist? Number one, are you putting profits over your patients? Well, if you are, you suck. And your patients, if they're not aware of it now, they will. And you know who probably knows it better than anybody else than your patients? Your staff. And if your office manager knows it, and your dental assistants know it, and your hygiene department knows it, then guess what? You have been infiltrated by your own doings. And the way in which to stop that now is to rewind this tip over and over and over and get indoctrinated by the words that are coming out of my mouth, because you will end up ceasing to exist. I don't care how much marketing you put out, it will fail to. Your practice will simply go down. And if your practice continues to thrive, you know what will go down? Your self-worth, the relationships, possibly even your health. So if you're a dentist that's trying to figure this out, this tip is just for you. Another way to figure out if you're going to be successful in dentistry is this. Number two, are you thinking long-term about the treatment that you're providing? You know, anytime I come to a case, I used to think, man, this crap is really tearing me up. I can't think, how should I do this? I'd be getting other doctors trying to figure stuff out. And I've been practicing at the time for like 5 or 6 years. I'm like, man, what am I doing? One of my mentors shared with me this information. Think long term. See, if you're just thinking about, hey, I want to get that boat, I want to buy that house, I want to get that car, I want to get out of the student debt. Well, guys, you're going to be a slave to making money. And if you have all the money but you don't have anybody to share with, that's probably not going to be a good place to be. And so what I want for you to do is think long term, because if you're placing that implant or taking out those teeth or doing some type of surgery that you have no business doing, but the only reason why you're doing it is just to get a check and it's not helping the patient, then you're going towards your demise. So think long term. As you're treatment planning, ask yourself, you know what? Will this last not 1 to 2, 3 years? Think 10, 15, 20 years down the line. Because the last thing you want to do is do something and it ends up failing later down the road. Like, that's not good advertisement for anybody. And if the patient says, you know what, I don't care about all that, I just want it to look good, I know it's going to fail, I don't mind paying you the money, I'm up to my wit's end, then you ask the patient, hey, you sure you want to do this? Then you give them the pros, the cons, and the alternatives so that the patient is completely on the same page. And then you ask them again. And then you sleep on it because you don't want to do something and the patient says, oh, I want to change my mind. And then if that happens, all hell breaks loose with litigation and all sorts of foolishness. And you don't want to find yourself in that situation, because no amount of money is worth lack of sleep, poor health, bad relationships that you'll endure if you fail to follow this principle. Another way in which you know that you're going to be successful at doing surgery is your willingness to refer. Now, I'm pretty sure you're like, well, how is that going to help me be successful at surgery if I'm referring? Well, guys, think about what I'm telling you here. The whole purpose of understanding will you be good at surgery is simply because you have zero ego. If you feel the patient comes into your office and they're not in a position to be treated by you, then you'll be like, you know what? Have a good one. If you're willing to do that, guys, that lets me know and should let you know that, man, I'm humble enough to acknowledge that I can only go to this point. What you need as the patient needs to go to this point. And by referring that out, that's great because you don't have to continue referring it out over and over and over. What you could do is compile those cases, bring them together, and simply start getting the courses and the coaching that you need in order to be successful. By your ability to understand that, hey, this is above my pay grade, let me know and will definitely let you know that you have success and that you will have prolonged success doing surgery in dentistry. Last but not least, I know this is a bonus, and so I really want to take my time on it. So the way in which you know that you'll be successful in surgery is that you will practice multidisciplinary dentistry. All right, for all those that are like, what? You will simply allow yourself to consult with multiple doctors under multiple specialties. Don't just go to your friends that are just like, oh, this is what I would do. No. Your friends may be morons. And if you're gonna smile after surgery, you can't deal with morons. You gotta deal with the best of the best, even if it costs you something. And cost is not always just financial, but it's the ability to be stretched, your time, your focus, all those things cost. And so if you're willing to look at and learn from other individuals that not just your core, and God forbid you're the smartest person in that core, you can forget about it. And so if you're willing to open up yourself to your thoughts, your desires, and what you wanted to do with this particular case, you have the ability to learn from this doctor, this specialty, and that specialty, allowing me to know, like, dog, man, you are on your way to being a successful dentist that can practice surgery and do very well, because you know what? You'll learn from all those individuals, and the next time, because dentistry is cyclical. What it's going to do, it's going to, a lot of stuff's going to happen, good, bad, and different, but it's a cyclical type of phase. And so by you learning from those individuals and then bringing it all together so that your patient can have the best, a couple things happen. You learn and your patient gets the best treatment possible. So there you have it, guys. I'm Dr. Jared Williams. And before I get you out of here, guys, I really want for you to understand that, hey, I need to know if these tips are helping you. So I want you to smash the like button, hit subscribe, share it with one of your colleagues, and the tip or the story that was resounding to you, I want you to put it in quotes, because somebody around the globe may just read your comment and be able to smile after surgery. All right, guys, I'm Dr. Jared Williams, and my focus is for you to remember, what looks hard is often easy. Make it a great one.